the distance CME makes a training budget more flexible?
Distance CME can definitely make your training budget much more flexible. One, we can upscale. As you add staff, as you add trucks, as you gain territory, your training budget pretty much stays the same. We can add anywhere from 1 to 10,000, yes. Yeah, thanks.
Start over? Yeah. No, but great thought, and then don't worry about, just let it flow. Don't worry about specific numbers.
Okay.
1 to 10 is just as good as 1 to 1,000.
1 to 1,000.
Yep.
All right.
Scott, what are ways the distance CME makes a training budget more flexible?
Your training budget can definitely be more flexible with distance CME. We can up growth from 1 to 1,000 employees as you gain territory, as you gain staff, as you gain ambulances. We can increase the spending budget, the spending power of your company without actually increasing your monetary outflow.
Awesome, I like it. Are we ready for part 2?
Sure.
I guess also I just want to, can you talk specifically, 3 more things since we're going to be cutting this in. Specifically the cost calculation, just like the sheet you have, walk through the cost calculation real quick of how distance CME compares to what you're already spending.
I like to use a cost comparison. So right now, let's say an average paramedic who's going to sit in a classroom for 48 hours. You're paying him $20 an hour to sit in that classroom. You're backfilling his shift, paying somebody time and a half, $30 an hour for 48 hours. That comes out to be about $2,000 for one person to sit in one class for 48 hours. If you were to just buy retail from Distance CME, that same 48-hour course is only $399. You're saving $1,600 and not having that non-productive employee sitting in that non-productive classroom.
All right. And then also, can you talk about the cost comparison actually at the dollars and cents level? Just the distance CME's, the most expensive distance CME training hour would only be $10.
When you do a cross comparison from either sending your employees to a training academy or you have your own training institute in-house, Distance CME's programs are usually around $10 a credit hour, far less than either paying instructors, paying employees, paying for a physical space. So $10 an hour definitely saves you a ton of money in your training educational budgets.
Next big macro question about it. Did good. Can you stand up real quick and just shake off the, yeah, so now you're, no, because I don't want you in your head.
Okay.
I just want you, okay, good. Ready for next question. All right. How does Distance CME approach continuing education? Specifically talking about how we're innovating.
Distance CME started out with a crazy notion of providing live online EMS education. That live component meets the National Registry's definition of non-distributive education. That way, your employees can now interact with other students and instructors from across the country. That way, you get a much diverse EMS educational experience.
Specifically talk about next how working to integrate DES into our platform is us innovating further in education.
Okay. Right now we're beta testing a new idea in EMS education, 3D and 2D patient care scenarios. Instead of a multiple choice exam to prove competency, which is the universal standard in EMS education, why not do a live 3D patient care scenario where your employees now can not only work their way through treating a patient that we can alter from one patient to another, one signs and symptoms to another, but your employees can now prove clinical competency and prove critical thinking skills. By using 3D simulation, you're going to save money on sim labs, instructor time, developing scenarios, and the equipment is much, much less expensive than, an $80,000 simulation mannequin.
So I've got 2 more questions. Basically, how do you use this, like the literal nuts and bolts of not every step, but how to sign up, how your guys use it? Just like we had with the IHS, and I don't even know how to do it. well, it's just come to our website. They find their course that's taught constantly. They log into the course and then they interact. Just kind of walk them through the functions of how it works. A few highlights of it.
Okay.
Yeah. So how does distance CME work at a system level?
It's exceptionally easy. Your employees just go to the Distance CME website, click Student Login. They'll log into their profile. There, we can see their student transcript, the courses that they've already taken and completed. All they have to do is take a peek at the calendar, see when the next course that they'd like to take is starting, and just log into the classroom by clicking the classroom button. There in the classroom, they'll see the PowerPoints, they'll hear a live instructor, and then they can interact with not only instructors from across the country, but students from across the country as well.
And then like the last question, just kind of take in the whole trade show, the whole thought of where do you, Scott McConnell, see EMS going? What catches your attention in the future of EMS?
The future of EMS education is definitely going to be something that's interesting. As we push into different fields, community paramedicine, greater critical care expertise in the paramedic realms, we're going to need a much more diverse way of providing EMS education, not only in a live setting, but we also have to do it in a way that your providers can now take it when it's convenient. It's exceptionally hard to take a week, 2 weeks, 3 weeks off to go sit in a classroom when you can just log in and take a class with us. So EMS education has to evolve, has to expand, and the easiest way to do that is live and online education.
So the part B to that question then, it's a kind of a credibility question. Why are you passionate about EMS? Like what drives you as as a paramedic?
I've been in EMS for close to 24 years now, and I'm really passionate about EMS and EMS education. You know, I can remember sitting in a classroom for 8, 10 hours at a time, and after the first hour or two, you start to wander off. What exactly are you actually getting from that class? That's why we basically chose 2-hour blocks of time. We keep your attention, we keep it focused, we add new things continually to our courses because, of course, learning the same thing just over and over again is not really learning anything. Expanding your horizons, interacting with providers from across the country. You're learning new things, you're learning the latest things in almost instantaneously and are able to ask questions and move through the EMS education where it's fun, it's exciting, and you're actually learning something.
So how much time have you shot?
We've enrolled about 8.5 minutes. You know, his material, I'd say it's around 5 minutes.
Yeah. Do you want to keep just asking more questions to add more B-roll?
Absolutely.
Okay, well, I'm just going to throw some questions at you that aren't, they're much narrower in focus.
Okay.
Have you talk about EMS World? Overall impressions, and then if you've seen anything cool.
EMS World is always an exciting time, especially for us here at Distance CME. It's a way for us to get our brand out. It's a way for us to interact with EMS providers. And walking around the trade show floor, you can definitely see some innovations here. New products, new ways of treating patients, the latest and greatest. Plus, an awesome way to get some EMS education. Distance CME is actually sponsoring the ALS track this year at EMS World because that's how passionate we are about EMS education. We're not just about ourselves, we're about you, getting the education that you need to continue to treat your patients.
This is going to sound like a dumb question, but people that follow us on Facebook, kind of a thank you for spending time, for keep coming back and learning with us, sharing with us, talking to us. We appreciate you and what you bring to our conversation.
I'd like to thank all of our Facebook fans out there. It's you that really help us to put out the material that you want to see. It's your comments, it's your suggestions that help us to not only educate on Facebook, but let you know about things that are happening with us and our family here at Distance CME.
Okay. I guess one more question that comes to mind. What's the hardest, or what are something hard or the challenges of putting all this together and running it? What takes where is the effort? Like not but just like some of this is easy, but something in this system that provides education has to be difficult. You know,
I got it.
providing this with you, one of the places where that's challenging for us is hiring new. I don't know. It is hiring new educators, providing technology that works for everybody, or I don't know what the answer is, but just inside of working at distance CME, what is the hard part?
The hardest part about distance CME was, and still is actually, is trying to convince people that just because you say online does not mean recorded courses, live webinars, interaction with a live instructor, conveniently done in 2-hour blocks of time that just happen again and again, changing days and changing times. That way you can get the education you need without having to take time off from work. One of the hardest things that we had to do at Distance CME 6 years ago was when we went to the national credentialing body, CSPME, CAPCE, and we had to explain to them that we were going to do live online webinars, live online courses. It just kept coming back to, well, these are recorded, correct? No, these are never recorded courses. They are always live. The frequency that they happen is just tremendous. In the month of September alone, we did 275 2-hour courses, happening morning, noon, night, and even overnight. So for the people who work night shift, stop trying to stay up all day to sit in a classroom. Take classes overnight that you're used to.
Awesome. Now that distance CME is a part of on-course learning, just like I guess on-course learning from the perspective of distance CME, why this is valuable.
Okay. So, as one of the founding members of Distance CME, we realized early on that we were going to need a little bit more in the background, a little bit more support, whether it be marketing, IT, technical support, whatever the case may be. And we happened to find a great partner in EMS education, On-Course Learning. On-Course Learning is the leader in healthcare continuing education, from physician, nurse, respiratory therapy, radiation therapy, and everything in between, from certified nursing assistants all the way up to a trauma surgeon. What better way to be able to showcase what we can do than with the backing of On-Course Learning? And that's why January 1st, 2016, we became a division of On-Course Learning, and I became the vice president of EMS education.
I'm out of good questions.
Yeah, I don't know. Is there anything else worth noting? I guess what have people been asking you about? Like,
there you
what's
go.
been the frequently asked question
At the trade show.
Also,
one thing, NCCR requirements.
As the EMS education changes, we saw the new national standard curriculum change, and we saw the National Registry now require a new way to recertify your pre-hospital status. We went from the old 72-hour model to the new NCCP model. Now, NCCP, National Core Competency Requirements, NCCR, it's a 30-hour course for paramedics covering specific material. Now, you still have 30 more hours to do, 15 at the local level and 15 at the individual level. We were actually doing these courses at the beginning of last year, covering the new material, covering the new way to recertify without any effort, without any lost time or lost money.
Oh, also one more thing. Not to keep talking about it. Can you briefly talk about flight paramedic certification, CCP, and then the three things, like how it contains the 16 hours, 64 hours of total, and then I forgot what the third one was you keep saying. Oh, BCC, TPC certified. That's what it is.
One of the things that we were constantly asked is, hey, I'm a paramedic and I've been a paramedic for quite a long time and I'm really interested in getting into critical care, both ground and air. Well, BCC TPC is an accrediting body, and we actually submitted a 60-hour critical care course to them. It was approved through BCC TPC for 60 hours of critical care content. Now, what this course can do for you is can prepare you to go take the flight paramedic certification exam and the critical care paramedic certification exam. And if you're already certified in either one of those, it can give you 60 of your 100 continuing education hour requirements. Now, as a flight paramedic, you know you also need those 16-hour core competency requirement components That's covered in our 60-hour critical care course.
I think we've got that, like, several of those things can be cut